So, you know, the debate is, should veins be treated in lipedema? And then if you would play Dr. McHutchinson's video, please.
Hi, we're talking today with Wendy McHutchinson about vein treatment in lipedema. And the question is, should veins be treated in lipedema?
So I'm from Louisiana, hence the mask. Sorry I can't be there. Tom, thank you for including me. Yes, I definitely think there's a place for treating veins in lipedema. The most important thing is setting expectation with the patient. Lipedema and veins have the same symptoms, and when I treat a patient with their venous disease, I tell them that I have reasonable expectation of possibly 20, 25, to 30% decrease in the symptoms. We're only going to get rid of the portion being contributed by the venous disease, and so the lipedema portion is going to still be there. So if that 20, 25% is enough to change the quality of life, the patient wants to do it, I say, let's go ahead. I also make sure they know that we're not going to change the shape of their leg, and we're not going to really affect their swelling, and that's their lipedema. The other thing as far as treatment, we need to be mindful of those lymphatics. These lymphatics do align themselves vertically with the great salvage vein. So when I treat these patients, I am very respectful of those lymphatics. I put those lymphatics on a pedestal. I stay about 3 to 4 centimeters off the junction. I never blade around the knee, and I liberally use tumescent just so that I can do as much protection as I can. As far as catheters, I prefer mechanical occlusion, although that's not really on all the private payer policies. So when I can, I use it. Sadly, the mechanical occlusion really has high failure rates, about 7 millimeters. And most lipedema patients have GSVs that are larger than that. It's unpublished. Hopefully I can come back to you next year with that. But and what I've seen is that those lipedema patients have really wide saphenous veins compared to non-lipedema patients. So that pretty much leaves us with glue or thermal ablation. Glue, I think you have to be really careful about it. That glue has reported sensitivity reactions, albeit rare. But one thing we know is very common with lipedema patients is the mast cell activation. We certainly wouldn't want to put a foreign body in someone who has an activated mast cell. So that sort of leaves thermal ablation, and use those treatment parameters that I use. I think you're going to have good results. I have good results, and Tom, unless you have a better reason to tell me not to, I'm going to keep doing it.
Oh, that's great. That's great. So, so just to summarize, you do recommend treating it as lipedema patients. Of course, setting the expectations and doing all you can to protect the lymphatics with generous tumescent and staying away from the junction and right around the knee. That's great. Thank you so much for your contribution, Lindy. We really appreciate your experience and insight.
Okay, y'all have fun in New Orleans.
So, you know, the counterpoint is, of course, that you're not going to change the swelling in the leg, and much of the pain that is reported in the legs of lipedema ladies is not necessarily improved when you treat their veins, and then we are always concerned about, as we learned today in our sessions earlier from Dr. Samaro, that the lymphatics do run in the saphenous sheath and nearby, and we want to be very careful about that. And so, we don't want to make anybody worse. And I have Lindy on speakerphone here now. I don't know how this is going to work. Lindy, can you hear us?
Yeah, no, absolutely. You may have to repeat a question and I'll do my best to answer it.
Okay, so we're going to just open it up for questions.
Will a stocking trial in your lipedema patients sort out those people who might improve their veins?
That's a great question. Did you hear that? Yep.
No.
I'm going to repeat the question really quick. So will stocking trial? Will stocking trial sort out who needs the vein treatment? And of course, it's because compression helps both lymphedema and vein disease. It may not really clarify it. Go ahead.
Hey, Lyndon, Dave Drawn. Do the patients with lipedema that want to go on to surgical decompression and liposuction type techniques, are those physicians wanting the veins treated first? I've had some patients that I've referred for lipedema surgery, the vein, and they had May Thurner, and they requested that we treat that before they treated the lipedema surgically.
That's a great question. So Lindy, questions about preparation before surgery. How does getting the veins treated? Is that something that surgeons want? Go ahead. So I would say that it's important because there's so many tributaries and that are going to lead to increased bleeding. Actually, these are long surgeries. We do see some blood loss, sometimes even a drop of a point in their hemoglobin. And if you treat the varicosities and the insufficiency, that you will that you're going to save that from. We're going to that will save protect from extra blood loss. Okay. So.
Thanks, Tom. Thanks, Lindy. I'd like to thank. Hello? Am I here? Thank you, Tom, Lindy. Thank you to everybody who spoke. We